Hi, my name is Lauren and this is Shannon Hibble, and we are both licensed marriage and family therapists and clinical directors at Akua Mind and Body Treatment Facility. And we are here to do a show called Awaken Soul.
I don't know if you've seen the episode by John Oliver on Rehab, but he talks about how, rehabs are promising 80% success rate, right?
Mm-hmm. There's clips with a lot of these treatment center owners saying, we can guarantee 80% success rate, or yes, if you come to us, you will be cured.
Yes. We are never telling clients that they will be cured after leaving here. And that is not something we tell the family members. If anything, we're acknowledging that that's not what's going to happen and actually coming up with a plan for when they do relapse. However, we also want to come up with a plan on how to prevent relapse as well. So I say that to all my clients in my groups is, you're not going to just do this exercise that I do with them and then now you're cured. Right. You have to keep doing this. This is a habitual thing that you need to do in order to help you stay sober. And so it's only those that continue doing the work are able to stay sober. But there's some unconscious factors at play that keep people from continuing to do the work. And that's why it's so important to see a therapist. So the therapist is the one that's calling out these unconscious factors at play. You can't think yourself through recovery. You have to actually feel it. And that's that unconscious, addressing the unconscious factors at play. And so a lot of treatment centers are not addressing the unconscious. And, I'm sure because John Oliver made a comment about, equine therapy and that's bullshit. And, there's no evidence-based for that, but there are evidence-based for short-term psychodynamic treatment. And there is research that says that actually the most important thing for cure is actually the relationship. That's what's most shown in research. And psychodynamic is more of a relational treatment. It's a more relational modality than the DBT and the CBT. Not saying we don't use those, because we definitely do. A lot of people will give me pushback about, you can't address the past. You need to just focus on the here and now. The past is the past. And I think that that's actually a defense. That's out of people's defenses, out of fear of addressing the past.
Well, psychodynamic, you can kind of glean it from the word itself, the dynamic, the psycho meaning psyche, which is a pretty complex, we can get into it, but it's a pretty complex way of looking at our soul, how it interacts with the biology of our brain. It's where our unconscious desires and motivations lie. It kind of creates our personality, our sense of self. And then dynamic is our approach to that. So psychodynamic does go into the past. That's created us as human beings today. And I know talking about how do you cure someone, I think Carl Jung always says that the cure is in looking at the neurosis itself. Why are we depressed? We're not here to cure your depression. That's kind of condescending to your depression. There's a reason you're depressed. There's a reason your psyche's depressed. The psyche's always working through something. So even a 14-year-old that picked up heroin might be doing the healthiest thing. Carl Jung says that it could be the healthiest response to an unhealthy environment. And so that's a good way in to address shame with a lot of our clients, is that a lot of our anxiety, our depression, our PTSD, even, the origins of some personality disorders and addictions likely come from the unhealthy environment around us. And basically our psyche is just trying to survive, trying to get those pleasure neurotransmitters to a good baseline, right? And so a lot of the behaviors that a lot of our clients are engaging in, and even unhealthy behaviors I engage in, if you look at the reason behind it, the impulse behind it, a lot of times it has to do with trying to just be okay in the world. And if I'm depressed, it's probably because, I'm not finding fulfillment in my job, or my parents haven't really been good enough parents, as Donald Winnicott calls it. And so there's a reason for that. Now, do we think that we need to dwell on the past for all of treatment? No. you're not responsible for what happened to you, but you are 100% responsible for what you do today to address it. And a lot of our clients don't want to do much when they really get honest. There's actually a terminology called secondary gain, where holding on to a trauma and not wanting to resolve it actually gives us a reason to drink, gives us a reason to stay small. And so we're also analyzing that. So psychodynamic goes back to the inner child, back to that moment when we were 6 years old and our father, gave us this angry look for dropping a dish on the floor. And then we felt that immediate shame. And that's coming up again when you're with your boss in a meeting and he gives you that angry look. And that's what we work through in EMDR, which we'll talk about in another episode, how those two are connected. And so the past is always connected to our present, but it no longer has to determine our present. And that's really the message of psychodynamic versus cognitive behavioral therapy, which we use every day here. It's creating a routine. It's creating tangible kind of things we can cross off a list so that clients can feel accomplished every day. I like to think of it as kind of the incremental daily, and psychodynamic is the deep, intensive work to excavate the past and how it affects our personality and our sense of self today.
Like I always say, pain demands to be felt. So if you've experienced pain, it's going to come out in some way. And so if you don't go through it, it's going to come out in other things like substance abuse, affairs, acting in ways that you wouldn't normally do, depression, anxiety. And so that's why we're really passionate about the way that we do therapy.
Mm-hmm. There's a lot of buzzwords. I think if you do like a Google search of treatment centers, you're going to find these buzzwords that kind of draw you in. Dual diagnosis being one of them. Dual meaning two. The diagnosis is what you're diagnosed with by a psychiatrist or a clinician. And a lot of times that's substance abuse coupled with a mental health illness. And I don't know about you, Shannon, but I don't think I've ever met anybody that walked through these doors here at Akua that didn't have, that just had a substance abuse issue. No one really, I believe, just picks up a substance and starts using it habitually and creates a dependence because everything in their life is fine. The substance abuse issue is a symptom. It's a self-medicator. Again, being that healthy response to an unhealthy environment. I drink to let go of my social anxiety. That's a positive thing. So you want to try to integrate in this world meaningfully. And maybe the, Xanax that your doctor prescribes you or the Lexapro doesn't really help you with your anxiety or depression as well as alcohol could. And so maybe your goal is to just be more okay when you go to a family function so that you don't freak out and want to leave because your aunt is asking you a lot of uncomfortable questions. So I'm going to drink. And then that becomes a dependency and a problem to the point that I need to drink when I wake up in the morning. So Akua really addresses, I believe, the underlying diagnoses that lead to the symptomology of unhealthy behaviors.
And I think it's funny that you say that because we hear that all the time. We'll go and market sometimes, but honestly, we are so focused on the clinical. But when I do go out there, I hear, we address the underlying issue. And I almost want to be like, but what does that mean to you? Because, and you have to be careful when you are looking for a treatment center because they can say that. They can say these buzzwords. Yes. I mean, I went to a marketing event and I start talking about psychodynamic and then they all start talking about how they do psychodynamic too. And I'm like, now all of a sudden psychodynamic is the new buzzword that people are using. And I'm like, but you don't have master level cognition. So there's no way you can do psychodynamic. And I'm sorry that my real feelings are coming out right now, but
it's not allowed here, Shannon.
I think that's totally my stuff and my fear of, what people will think of me, because I'm not trying to bash other places, but at the same time, I'm protective of our clients.
One other thing I wanted to mention was the holistic aspect. Again, holistic and trauma focused, more buzzwords that I hear a lot on brochures and on websites. And we've been really mindful about how we do that. And I think bringing in the Eastern practices while blended with Western. And just to give you an idea, the substance abuse treatment is really kind of bringing in the program of Alcoholics Anonymous, which kind of reprograms the brain in a healthy way. And as a psychodynamic therapist, those 12 steps are really aligned with the 12 steps of the hero's journey too. And it's a powerful thing. And then also just, relapse prevention, understanding triggers. Those are all kind of substance abuse modalities. Now, the psychodynamic also encompasses a lot of the Eastern modalities, which could be, we bring in Reiki, which brings mind-body awareness, a lot of mindfulness meditation that helps with a lot of anxiety. sound healing. We have a sound bath healer. I have a gong healer down in San Diego that the vibrations can really help the body. And a lot of people that haven't experienced these things before, it's an act of surrender to be in a sound bath group or to be with our heart therapist. It's an act of surrender to just be in our thoughts with some kind of music or vibration. And that teaches them to just be okay in the moment. We don't have to always talk. And I hear a lot of clients say that it's in, sound bath healing that I had this epiphany, or I released this anger or this pain. There is this illusion that we have to talk about the pain. And as therapists, I think a lot of times our ego gets caught in, if our client didn't tell it to us, then we don't know about it and we can't fix it. That's untrue. If it's in the client's body and it's in their brain, trauma is stored in the body, if they can release it on their own, a lot of the healing that's happening might not even be reported to us. It might just be in their psyche. And so I think that's part of the Eastern methodology. And we, joke about equine therapy, and we joke about all these other modalities, acupuncture and things like that. There is starting to be a lot more evidence for these modalities and integrating them with, the psychopharmacology and seeing a psychiatrist and the Western modalities.
There's a lot of people that have told us, they disagree with the way that we do treatment because we're trying to awaken the soul earlier. So right. I wonder what your thoughts are on that. I mean, I know I'm sharing what it is that our thoughts are, but what would you say to those people that do come up to us?
Oh yeah, they do all the time. I think, the unconscious is already at play. So my argument would be your unconscious is already there, and we've got to deal with it. So it's more of our fear, I think, as clinicians, bringing up the dark and the heavy. If we talk about that rape when you were younger, or that, trauma from your parent leaving you, that's going to bring up a lot of dark emotions, and we don't want to upset them, and, they could become suicidal. And trust me, they've already been living with that. Mm-hmm. So we've got to check ourselves, I think, as clinicians on what our fear is for going into the darkness. Have we done the work to hold space with the darkness? And what is our apprehension? And I hear this sometimes from insurance companies. We don't want you to go there. Just let's keep them sober, keep drug testing.
But just abstaining from a substance is not actually curing the person.
We can keep anybody sober for 30 days. We can drug test you every day. We can keep you in a house and keep you monitored and supervised. That's not what I'm interested in. I'll sleep well at night that way, but really, truly, are you going to leave our facility knowing yourself better, understanding your impulses more? When we're awakening the soul, it's going to be uncomfortable. Yes. It's going to be hard. You're going to start pulling up, the past and things you're not proud of, things that you live with, nightmares, flashbacks, insecurities, fears. Of course, you're going to want to drink probably 10 times more than when you came in. So when we talk about relapse, I never ever, one of the things when our clients call, I never ever shame them. I'm never disappointed. It's always, wow, okay, so you're learning. And did that work for you? And maybe they just had one drink and it didn't feel the same. So relapse carries with it this statistic and this stigma. And, you could relapse 3 times but every single time we're planting a seed. And the psyche is always trying to self-regulate and find its way home. And sometimes that way home is trying it again, maybe in a different way. I can control it. And that's one of the myths and illusions of addiction, is it creates in the limbic system that pleasure cycle that says, I need to figure out how to have my drug of choice and have a functional life too.
Really, the one word that comes to mind when I think of psychodynamic is unconscious. Mm-hmm. And a lot of modalities kind of don't address the unconscious. For instance, let's say we have a male client that comes in and he has had affairs. And so he feels so much shame because of the affairs that he's been having. And it's hurting his wife. He could see it. Mm-hmm. He doesn't really recognize why he's doing it. And so then he drinks because he doesn't know how to cope, right, with being quote unquote a cheater. And he doesn't want to. That's not he doesn't want to cheat. And so, or at least that's what he's expressing to us. Now, with psychodynamic, my hope would be for him to actually express that there is a part of him that is attracted and excited by something else. But to acknowledge that, to say that when someone values loyalty, trust, fidelity, right? They're not going to acknowledge that. And what we call that as a defense is repression. And so people repress these desires and these wants because they see them as bad. And so they don't acknowledge them. And when they don't acknowledge them and you repress them, they get stronger. And so when, you know, their wives are saying like, why are you doing this? They really don't know. They don't know. And it seems like a cop-out, but it's our goal for them to actually feel safe enough to express their unconscious wants and desires, because only by doing that can you actually heal them. Because there's something going on if he authentically wants to stay loyal to his wife, but yet is cheating.
His actions aren't aligning.
He's not aligning. So then that means there's something going on. There's an unconscious force at play. And so we want to explore that and heal that, because he ultimately wants to be faithful.
The impulse towards the bad is also part of who we are. There might be something missing in the love relationship, maybe the excitement of the newness of the mystery. My value might be loyalty, but why have I committed this infidelity? It doesn't align, and now we have to live with this paradox. But that infidelity is also part of the soul's calling. And so that's important that we acknowledge it. It might not be right, and the wife might not want to stay with the husband, which is totally acceptable. That's her boundary. But acknowledging that complex is huge. And it's not just good and bad. There, you know, it's that usually that healthy response, even though cheating isn't healthy, but it's
telling us something.
It's telling us something.
It's telling us something.
And we got to explore that rather than just repressing it more. And I feel like a lot of treatment represses it more. That's bad. So let's not look at that anymore. You did it. Forgive yourself. No, let's actually bring it up.
Explore it.
Let's explore why you did that. Let's see, did your wife have a part to play? Not, you know, and that can be very controversial too. Let's look at that.
Clients feel that it's different. Wait, we can talk about this? I can talk about me cheating on my wife and I'm not seen as bad. I actually, it's giving information, and a lot of times it's communicating to us that he is wanting something in the relationship that he might not be getting, but he doesn't feel comfortable enough to share that with his wife because he doesn't want wife to feel rejected. And so it's this, we call it codependency, caring so much about the other person's wants and needs that, and not really looking at yourself, right? Because you don't want to hurt the other. Because if you hurt the other, then you're scared you're going to hurt yourself. That if I tell my wife, you know what I'm wanting is more excitement in my sex life, could you imagine how that could be for the wife? I'm not enough.
But right? That's her own stuff.
That's her own stuff.
Right.
That would be her own stuff. If she's not able to hear, hear, I want more excitement in my sex life. Maybe she's feeling the same way, and let's do something about it, right? But if she falls into feeling like, I must not be good enough, she needs to work on that, right? And so it's so complex, and that's why it's dynamic. But we want to explore what's preventing someone from really expressing what it is they're wanting from the relationship. And that's really important to do, or they're going to just hold it in and it's going to come out in other ways. There's a risk going into awakening your soul because it might bring up stuff and you might not enjoy your life for the first bit. It might not work. There's risk involved. However, you have to. Just like with cancer, you have to go in there in order to remove it or you will not be healed. And that's the case here, is if you don't go in it, it will never be healed. So it really is. So that's why I don't want to shame people who don't want to do that kind of work, because sometimes they say, my choice is I don't want to go into the deeper work because I just like the way that my life is. This is good enough, right? And so we have to check ourselves because we've experienced going into the depths and we've seen how it's changed our lives and transformed, and we want that for others. But we also have to watch ourselves too and give what it is that the client is wanting and asking for as well, because we want to be respectful.
One thing I will say is if a family member calls and it's not necessarily the client, we want to hear from the client. Every client here, I believe, is self-motivated, willing, and if they're not, they're kind of weeding themselves out a little bit. For us, calling a KUA is, that takes a lot of courage, to pick up the phone and admit you have a problem that you're powerless over. So we treat that with a lot of care. You wouldn't just be calling some remote call center. Our admissions team is integrated with our clinical team, and we're constantly in contact. And as clinicians, we review all the information, make sure that you're a good fit. We express our concerns. I think we're very transparent because it's a very symbiotic relationship. It's kind of like going in for a job interview. You want to, it's not just the employer that wants to feel good about hiring the employee. If you're coming in for the job, you want to know that it's a good fit for you as well. You're putting a lot on the line.
It's that tension of like, okay, yes, we're all in this together. We don't care where you go because as long as you're getting help. But as we've been conveying, there's some, feelings of, I don't know if I can trust, but it's not necessarily on just some of the other treatment centers. And I'm sure there's also some really great other treatment centers out there. I just don't know them personally.
In the treatment world, there's a lot of that kind of idea that, we're the best. And how do you communicate that? When really, we don't really know if we're the best. And what does that mean to individuals? We can only do what we know we're strong at. And so Awaken Your Soul is really about, not just inviting our clients to kind of start to understand their true purpose. That's what awakening looks like. It's becoming aware, right? It doesn't necessarily mean we're curing your soul or fixing your soul. We don't have the power to do that. It's really awakening, becoming more aware. And that word soul can be a little interesting to a lot of people. But it can mean a lot of different things to everybody. And I think that's part of the purpose for choosing those words. It can mean our heart, our connection to others, our life's meaning, our purpose, our direction, our path. And, getting lost on that path is truly where mental illness and addiction kind of come up. We want to thank all of you guys for listening to our first episode. And we encourage you to subscribe, to like, to comment on the video if you enjoyed it. And we look forward to seeing you next time. Thank you.